Hello, and welcome to Hopkins at Home. Thank you for joining us. I'm Keri Althoff, an Associate Professor of Epidemiology at the Johns Hopkins Bloomberg School of Public Health. So for today, we are going to be talking about gathering and traveling during this holiday season. Yes, we are still in a pandemic, but things are looking much brighter, especially for those who have received full vaccination. So to get started, I also want to let you know that we have a chat box at the bottom of your screen. Please do write in questions at the end of the talk. I will be answering those questions. So we have the wonderful Hopkins at Home team here to support us. Please write your questions in, and I look forward to answering them towards the end of the talk. So let's get started. Gathering and traveling during a pandemic. You may have remembered I did this talk last year. There are a lot of updates this year. We're in a much different place with the pandemic. So let's turn over here to the Hopkins map, looking at the proportion or the number of coronavirus new cases per population. So this is scaled to the size of the underlying population in our US counties. And we can see that some of our colder area states are experiencing higher transmission rates, but we also have some transmission going on in the Southwest that we're keeping our eye on. So just for the global perspective here, across the United States, as I know many people will be traveling this holiday season, but of course, this map doesn't always tell us exactly what's going on in our own backyards, which is really where we need to be focused when making decisions this holiday season. So in 2021, we had the pandemic game changer occur. Safe and effective vaccines are now available for people ages 5 years and older. But it's really important to note that it's only the 12 and older people who have had the time to be fully vaccinated and or even receive a booster. 5 to 11-year-old kids will not be fully vaccinated. Pfizer is the only vaccine currently approved. It's an mRNA vaccine, and it's for use in kids, and it started its rollout on November 3rd. So at this point, most kids are just getting ready to receive their second dose. Those early adopters are receiving their second dose, but there are still many, many, many unvaccinated children or children who are not fully vaccinated in that 5 to 11-year-old age group. In addition, the booster announcement just came out a few days ago that suggests anybody 18 and older can decide to get a booster. And the CDC has provided good guidance around that. So let's just be clear that, not everybody is boosted, but thankfully we have large proportions of persons who are vaccinated. And we're going to look at that in our own communities where we're hosting or traveling for gatherings. And also we have to remember that these individuals, there are pockets of individuals that are not yet fully vaccinated as they have not had access to vaccine. But the good news is so many kids, 5 to 11, were vaccinated in the first week of rollout. It was an amazing accomplishment for the nation to see so many kids. I have 3 children. I was definitely an early adopter. I am so happy that my kids are receiving this protection from December and the winter holidays. I know my children will be fully protected. The other game changer that was not the positive game changer that the vaccine was the Delta variant. So everybody knows Delta by name now. And this variant really emerged in about July in the US. It really became a force. And it really put a strain and found unvaccinated populations all over the country, overloaded hospitals. It was very, very challenging for so many counties in our country that had low vaccination uptake. It is a more transmissible variant than Alpha or the parent variant that were previously circulating. And more transmissible just means that there's a higher probability of infection if you do come in contact with that virus. And a higher level, therefore, of population immunity is going to be needed to really slow down that virus, slow down those transmissions, and then reduce the likelihood that you come in contact. So overall, we have to remember that we did see, that dramatic peak in the middle of that graph there was last winter and our most, terrifying and deadliest surges. And then the Delta wave happening, you can see between June and October, but also notice we are starting to uptick, that we never really came down from the Delta wave to the valley that we saw in June. And we're already starting to tick up. This is the beginning of the winter surge in the United States. We do not anticipate it getting as deadly as what the surge was before we were able to vaccinate the population. But if you are unvaccinated, Delta is very good at finding unvaccinated individuals and making them ill. So please consider vaccination if you have not already done so. And if you are vaccinated, please be aware that we are starting this uptick. So if you need a booster, get that booster. If you are at higher risk for severe COVID, if you do become infected, it's time to think through some additional mitigation strategies. So as you're planning your gathering, the two kind of areas that your brain needs to be operating in to ensure a safe and happy gathering is to think through, of everybody you've invited, what is the proportion who are going to be vaccinated? And if you're a guest, you can think through this too, right? How many people will be there? What proportion will be vaccinated? The percent of people with an increased risk of severe COVID illness should also be thought about. And this includes, some of our cherished family members, our older adults, the grandmas and the grandpas. We know that there's more severe illness at older age. We also know there's more severe illness in people who are obese and people who have mental health conditions. So there's a very wide range of conditions, and we'll talk a little bit more about that. So really keeping in mind that even though some people might be vaccinated, they might also be at higher risk for severe illness if they become infected. And so we're going to perhaps just put on a few extra layers of protection. We'll talk about that in a moment. And then next, the geographic area in which you are gathering and from where your guests reside and are traveling from. So think about, okay, where are they coming from? What are their communities' vaccination coverage percentages? And what is the COVID transmission rate in those areas in which they're coming? And what am I asking them to come to? What's my local coverage rate for vaccination? And what's my local COVID-19 transmission rate? All of that can be found at the state level for sure. Most states have very active websites, and you can even drill down to the county level, and we'll take a look at that in a moment. So if you are planning a gathering, I'm sure you've already probably tried to have this conversation with your guests about vaccination. Now, some guests may be very forthcoming as we're looking forward to coming, we're fully vaccinated, we can't wait. Other guests may not want to disclose that information. Always come from a place of empathy when you're asking for information like this, and make sure that they understand that that information is not you trying to invade privacy by any means. What this is it's actionable information. It's information that you need to help plan which mitigation strategies might be best suited to keep everybody safe. And you know what? Don't push it, right? If someone is upset by the question, just proceed as if they are unvaccinated in your planning. And then think through, okay, overall, what proportion of my guests are vaccinated? If it's less than 100%, if you know you have kids under the age of 12, if you have a family member where no one knows their vaccination status and you're going to say, I'm just going to assume they're unvaccinated, that proportion of your guests that are vaccinated is going to be less than 100%. And if that's the case, it's time to really start thinking about some mitigation strategies. Individuals who have an increased risk of severe COVID are also the other group that we're going to be thinking about when it comes to mitigation strategies. And as I alluded to just a moment ago, there are a number of different conditions that result in individuals having an increased risk of severe COVID. Now, if they're vaccinated, their risk of COVID after vaccination is going to plummet dramatically. That being said, if you do have an older, more frail adult who wants to attend, thinking through making sure there's good airflow, ventilation in your space, thinking through maybe whether or not that person may want to wear a mask or others may want to wear a mask when in close contact with that person, to just help protect them. And again, it's not just COVID, right? Our older adults are also susceptible to influenza, which is starting to rear its head in different spots of the country. So individuals at higher risk for severe COVID-19 disease include a number of different conditions. And so thinking through, will there be guests at your gathering that are at an increased risk for severe COVID-19 illness? If the answer to that question is yes, and I think for most families and friend gatherings, the answer is yes, then we should also be thinking about some mitigation strategies. So breakthroughs, what's a breakthrough? This is a confirmed COVID-19 illness or even just an infection that doesn't cause much disease, and it occurs after vaccination. And you can see here, this is the Maryland data. So of 1,000 fully vaccinated individuals, the individuals who are fully vaccinated Maryland residents who are individuals who are not who are hospitalized and have severe illness who are having these vaccinations. It's very few individuals who have breakthroughs. And we can see overall, the CDC has shown us in this graph that your incidence or the rate at which breakthroughs are occurring is much higher in that black line, the unvaccinated, compared to the fully vaccinated. And just yesterday, the CDC came out with new data and said, compared to vaccinated people, unvaccinated people have 6 times the risk of infection and 14 times the risk of death as unvaccinated people. So vaccination is really where it's at. That's why the public health community has really been pushing for vaccination to get everybody safe and protected from both infection and death. Breakthroughs do occur in immune compromised people who are fully vaccinated, and it's believed to occur at a slightly higher rate. What that means is if you are immune competent, you don't have any diseases or conditions that can decrease your immune system, then the vaccines we know work at about 90% or so. And it's starting to decline a number of months out from vaccination, and that's why boosters were recommended. But if you are immune compromised in any way, and the most severe immune compromised, i.e. those individuals who are taking drugs to actively suppress their immune system because, for example, they're organ transplant recipients. So some of our most immune compromised populations are actually recommended to receive not just the 2 doses of an mRNA or a single dose of the J&J vaccine, but also then an additional dose in order to complete. So they're asked to get an additional dose compared to everybody else in the population to continue to boost that immune system. But breakthroughs are still more likely to occur in these populations. So that's just something to keep in mind if you have guests or if you're going to an event where there are individuals in there you know that are immune suppressed or immune compromised. The percent vaccinated. So let's dive into this idea when you're talking about the percent vaccinated within your group, but also in your community. So we know that the vaccine protects individuals, and the vaccines build what we call population immunity, and that slows down the transmission of the virus, making it less likely for the virus to come into contact with more people. So ask yourself a couple of questions, do just a little bit of digging here to figure out the proportion of people in your community that are vaccinated at the location where you're gathering. So the community in which you're gathering. If you're having people come to you, what is the proportion vaccinated in your community? And then where are those people, those guests traveling from? Think about what the proportions of vaccinated persons are in those communities so you have an idea of the risk of that individual encountering the virus within the last few days prior to arrival at your house. We can look for the percent vaccinated online in a number of different formats. And one thing I just want you to pay attention to is when we talk about a percentage, there's a numerator and a denominator. And the denominator is kind of where all the action is in a percentage. When we even look at nationwide data, this is the CDC data as of yesterday. I clicked to the tab that says fully vaccinated because I want to know the people who have had their full immunization series and are fully vaccinated. And what we see here are these percentages and these different populations that are stratified by age groups. the percentage is increasing as we go down these age groups. Well, the denominator here is really getting smaller as we go down. In addition, that population 65 and above, we know there's been great vaccine uptake there. They're at 86%. But when we look at those greater than or equal to 5 years of age, so this is now everyone who's eligible to receive vaccine, but as we stated at the beginning, those between 5 and 11 are not yet fully vaccinated. And so we see here that it's only about 63% of our country is really who's eligible for vaccine at this time. 63% are fully vaccinated. And then I also think it's really important to keep in mind that all of those less than 5-year-olds that are running around out there who are so fun to see at the holidays and really bring smiles to people's faces, those are completely unvaccinated populations. So those kids don't have any access to vaccine right now. Hopefully that will change in the coming months. And when we add them into the denominator, so we have a fuller picture of the proportion of individuals that we would encounter in our communities who are vaccinated, it is just under 60%. So that's a sobering statistic. We just have to remember that as we're making these plans. So I look here in Maryland. This is an example of state level data that you can go to and you can drill down. And here we can see we're in Baltimore City. So this is about a 56.8% coverage, which is pretty low. And so when we look here at these different counties to see what their vaccination coverage is, it's important to kind of understand where you are, and that can help you think through the likelihood, the likelihood that you would come into contact with the virus in the days preceding your event. Transmission is the other piece we're going to think through right now. So COVID-19 transmission is that rate, right, of COVID transmission, how quickly it's moving from person to person in your community. And a higher rate signals a greater likelihood that you do encounter COVID-19 in your community. So looking through what is the COVID-19 transmission rate in your community, and what is the COVID-19 transmission rate in the communities that guests are coming from. And in the state of Maryland, I can pull up easily and quickly from our state's website the 7-day moving average case rate per 100,000 population. So this is scaled to the population. And we see, again, this little uptick that's occurring at the end, which actually, it really does make me nervous. It makes me kind of rethink, I am not the one to be cooking the day after Thanksgiving. I'm a little exhausted. I would love to go out to eat the day after Thanksgiving, but you know what? With this gentle uptick, I'm going to choose outdoor dining with my boots and my coat on rather than indoor dining, especially if we're going to meet grandparents, for example, or if we plan to take our children. And so that's what we're thinking about when we're looking at these trends overall in the COVID transmission. We can also look at the rate itself and see the categorization of that rate according to the CDC categories. And we do see that there is high and substantial transmission throughout the state. Even with, overall, there is pretty good coverage of vaccination in the state of Maryland. And we still see this rate, and that's just simply because Delta is very transmissible. So we need a higher population immunity in order to really slow down that virus. We have not met it yet because we have not seen these rates come down. You can look state by state if you're planning on getting on a plane or in a train or an automobile to travel to see. And just a state of comparison, I know we're kind of getting a little bit nervous about this uptick that we're seeing this winter, and we do need to keep our eye on it because we do not want to be in a situation where shutdowns are occurring. And we see what's happening in Europe, where there are lockdowns that are occurring in countries that have 60% vaccination rates, similar to where we're at. Excuse me. We really want to avoid that. And I do just want to point out, we're better than where we were a year ago. So take a look at what this map looked like 2 days before Thanksgiving last year. We saw a lot more transmission. And we saw a lot of upticks in transmission. And so this is just important to keep in mind that we are looking good, but we know this is tenuous, and our actions do contribute to whether or not we're slowing that virus or we're increasing that virus. If you want to stay up to date, please do go on to this US epidemic daily check-in. This is amazing, just quick visualization of the data that shows the deaths, the cases, the testing, the positivity ratio. It looks at the US, it looks globally, and it's just important to know where we are. It feels like the pandemic is coming to a close for many of us. And I think the vaccine has helped many of us regain some of the connections in the face-to-face manner that we had sorely missed in the last year. But we still need to remember that 92,000 adults tested positive yesterday for, I'm sorry, not just adults, all total persons in the US tested positive yesterday. That's 64 positive results every minute occurring in the United States. And there were sadly over 1,000 deaths yesterday from COVID. That's one COVID-related death every 1 minute and 17 seconds. So those numbers just help to ground us and remind us that the pandemic, the US epidemic, is still ongoing. So what do we do? What do we do to get ready for this great holiday that I know we're all looking forward to? Thanksgiving is filled with family and friends and usually delicious food. There's no stress of gifts. It's just about being together and maybe a little football watching or whatever. Getting ready for Christmas starts, it seems, immediately afterwards, as well as for Hanukkah and the additional winter holidays. It's just a nice long weekend. So let's think a little bit about the guidance. So last year's guidance from the CDC, it was much more bleak. It was, the safest way to celebrate is at home with the people you live with. There really wasn't any guidance to gather in bigger groups, but that has changed with the vaccine. And we recognize that holiday traditions are important. It's important for families. It's important for children. So we think about the best way to minimize our risk and still have these connections. And that's, first of all, to get vaccinated. So let's do that. Second of all, wear a mask if you're indoor in public settings, especially if you are unvaccinated or immune compromised. If you are vaccinated and you're still in an area of substantial or high transmission, for example, where I live, I am still wearing a mask. Regardless of the level of transmission, if you have someone in your household that is unvaccinated or at risk for severe disease, or you're going to be gathering with someone, it's a good idea to get that mask on even in the days before the gathering to make sure you're not bringing anything to that gathering. Avoid crowds, avoid poorly ventilated spaces. If you have symptoms, stay home, which can be one of the most crushing things to wake up with symptoms on the morning of the holiday, but you have to think bigger about just being sure you're not going to bring something to that gathering that truly nobody wants. Nobody wants COVID. And then get tested if you have symptoms and ask your guests to get tested before a gathering. We're going to talk about that in just a moment. So if you're not vaccinated, one more plug, a long weekend is an excellent time. If you are off work, if you can take an extra down day, get vaccinated this weekend, because then you will be vaccinated if you stick to the schedule. You'll be vaccinated fully by New Year's Eve and you'll start 2020 off right, 2022. If you have less than 100% vaccination coverage among your guests, or you're attending an event and you know that the vaccination coverage is less than 100%, or you know that there are people who are attending that are at severe risk for COVID-19 illness, think about these different strategies. First of all, the smaller the gathering, the better. Gather outdoors, enjoy beautiful sunshine if that's available in your area. Increase the ventilation indoors, move the air, even opening a few windows. Just make sure you have a couple of throws around, so if people are chilly, they can put a blanket on their lap or put their coat back on. Masks indoors can be used, absolutely, especially if you have a pretty solid proportion of individuals attending your gathering who are not yet vaccinated. And then spread out to eat. And maybe that means, there'll be a couple people eating at a time at a larger table, or maybe you use other spaces in your house for eating, and then you can kind of group households together for that. Day of at-home antigen tests. Now, I know these are very hard to get in a lot of places in the United States, and we will continue to push to ensure everybody has access to these at-home tests because they are so helpful. They're basically nasal swabs, and you can just use them the morning of, and in 15 minutes at home, you can have a result. Now, these tests are very good at picking up infectious people. They're very good at picking up infectious people, particularly if you have a symptom or two. So if you get a positive test, it means you do need to stay home. So if you wake up and you have a scratchy throat and you think, oof, was that the dry plane air that I was breathing in all day yesterday? Or is it just because I'm in a new space, I'm staying at my aunt's house or my brother's house, and there might be allergens around here, my allergies are flaring? Take that at-home antigen test, because that piece of information as to whether or not that comes back positive is hugely important for how you're going to conduct yourself and kind of keep to yourself if you're positive, to ensure that you're not infecting others. And then, of course, if you are fully vaccinated and you've got all of your friends or family gathered and they are fully vaccinated, and you don't have individuals who are at an increased high risk of severe COVID illness, I mean, sit down, have a meal, enjoy each other, and celebrate Thanksgiving. So last minute prep, do you have a rapid antigen test in your house in case someone wakes up or shows up with a symptom? And I'll just tell you, Walgreens, CVS, all the local pharmacies, every once in a while, Amazon has them. I personally am going to try and find some and give them away for Christmas gifts this year, because I felt like we have all been scrambling to find some of these to just have a backup or two in our house for moments like this. And you can even ask individuals, particularly if you don't know their vaccination status, to do a test either the morning of, or if you have access to, provide them a test when they arrive to your gathering, if you just want to have that extra assurance that individuals there at the gathering are not likely to be infectious and spreading the virus. If you have guests who are in your home, and let's say that antigen test comes back positive, or you don't have access to that at-home antigen test, do you know where you can go to receive a laboratory-based test? So making sure you have reviewed kind of what the options are. I know some states have been moving around their testing facilities and their hours. So make sure you have that top of mind. Which mitigation strategies will you be putting in place? And did you need to implement your plan B? Was, sadly, it was the kind of go-to last year, which was, if anything kind of goes awry, you would just cancel the event and celebrate just with your household. Plan B this year still is canceling the event, but I think it's more reserved to a situation where you know that the host is not feeling well. That's a plan B moment where you cancel the event. If you wake up as a guest and you're not feeling well that morning, then that's a plan B moment for you as well, to stay home and to not infect others. And then, of course, don't forget your turkey, your seasonings, and all your fixins for your meal. For those who choose not to attend the event, and there are going to be people with young kids, people who are at severe risk, maybe there are people in your life who have experienced a bad bout of COVID and they are not willing to risk it this year. Remember to reach into them. So send them a favorite treat, FaceTime them from the gathering, send a handwritten note, read a book together, send a puzzle, do something to make that connection, to let them know that even though they could not attend, you are thinking about them, and you are excited to see them again when the circumstances allow. So the other thing we just have to be cognizant of is that we do prepare for the spike that occurred last year, right after the Thanksgiving holiday. Numbers continued to go up and up and up, and they peaked in January, and it was a very dark winter for so many families across the country. And so I think what we need to do is just be prepared this year. So is your household stocked? Remembering that if you do have an infection in your household, there should be an isolation for that person, a quarantine for the family. What are those plans? Dust them off if you haven't thought of them in quite a while because you're fully vaccinated. And how will you reduce your risk if you start to continue to see these cases going up and up and up that we've already started to see? So it can be very simple things, putting your mask back on in the grocery store, reducing your grocery runs from maybe twice a week to once a week. It's those small steps, particularly if you have other mitigation strategies, like you're vaccinated, for example. if you're able to just layer on just a little bit of concern and make sure that you're reducing your exposure, it can actually make a big impact on your community because everybody works together to slow down this virus. So after Thanksgiving, what does this mean for the winter holidays? So if you are planning a winter gathering, you know what? Get it on the calendar. I'm sure most of you have if you're planning to host, and then talk about the goals and the ground rules with your guests. And this might be a good time. Oftentimes families start talking about the winter holidays during the Thanksgiving gathering. So what do you really want to accomplish with that gathering? Maybe it's that you all want to get the Christmas tree this year. Maybe it's that you all want to go out and attend some sort of event, an outdoor event. There are lots of lights to see this time of year, those types of things. What are the risks and benefits to you and your loved ones, and how can you take them into account, both the physical and the mental health benefits? People really do need that connection. And how can you break down the possible solutions into those lower risk steps to make sure that you can accomplish both of those kind of needs to protect yourself both physically, but also mentally and emotionally, and build our resilience and our recharge with our family and friends. Have this conversation and talk through what the plans are. I think you will have more people attending the event, and you may feel more likely to attend the event as a guest if you are part of the process to say, this is what, I'm comfortable doing. This is where my risk tolerance is. And this would be great if we could figure out a way to help kind of find that middle ground with everybody's risk tolerance. So your plan A should come out of that conversation, and it should also be informed by the latest data. So keeping our eye from now through the winter holidays on the proportion vaccinated in your community, you will see it start to tick up because those 5-year-olds and above are going to start reaching, the 5 to 11-year-olds will start reaching fully vaccinated status over the course of even the next few weeks. So hopefully we'll see a little bit of an uptick there. Look at that COVID-19 transmission rate. And then, of course, the one thing that we haven't talked extensively about yet is the percent of hospital beds in use. And this is going to be very different based on where you live and the availability of hospital beds and even ICU beds. But this is where we want to keep an eye on the health system, because we don't want to be incurring the risk of exposure and infection at a time when the health systems are overwhelmed and overloaded. That doesn't help either the sick patient or the individual. So if we can reduce our exposures during those times, it's really important that we do. Make a plan A for your gathering. That includes the ways you will reduce the risk and have that plan in place 2 weeks before the gathering. And make sure that you are thinking through who is severe, who could develop severe COVID-19 illness. Make sure that you're also thinking through how we can reduce exposure 7 days prior to any of the gatherings, particularly as we do suspect these transmissions will increase. The rate of transmission will continue to tick up, sadly, over the winter months here. And then, make sure you can find some rapid at-home antigen tests and also know where testing is in your community. So being fully vaccinated and taking a test just prior to the gathering, if anyone has any symptoms, are really surefire ways to enjoy those holiday celebrations that look and feel a little bit more like 2019 than 2020. And then, of course, have your additional plans, right? And make your plan a little bit modifiable, right? So 1 week before the gathering, really thinking through, especially because I think some families are planning bigger gatherings of vaccinated people, but it's still important to have a 1 week check-in right before. How's everybody feeling? What's going on? I know in my larger extended family, there was, just 2 cases of COVID in a week's time span before an outdoor event that my family was planning, and the outdoor event was canceled just because those cases were coming from the community and we weren't sure that there was going to be a low enough level of risk there. So it was postponed to another time, and that was an outdoor event. So making sure you're kind of modifying your plans. Plans C should be modifications to plan B. So you develop these layers, right? And they're layers that are occurring in time to the event. So a week before any modifications to plan A, a few days before any additional modifications, and then of course the morning of, And just preparing yourself that postponement may have to happen if the host wakes up and is not feeling well, or postponement or cancellation might happen for you as a guest if you wake up and you're not feeling well. And then, of course, make sure that you know when you're hosting a gathering, what happens if someone does become ill and calls you and says, oh, so, I know I was at your gathering 2 days ago and I just tested positive for COVID. What is your plan of action there? How will you stay in touch about symptoms with your guests? If someone becomes ill, who will call those other guests? Who will call the health department if contact tracing is still active in your community? And make sure, again, that your quarantine plan, your isolation plan, all of that is in place, because we want, to be able to support each other if COVID does unfortunately make an appearance at anybody's celebration. Now, some people will be traveling. Airports are reporting upticks in the number of passengers. This is a place where people are coming from all over, different levels of COVID transmission, different proportions of vaccinated in their home communities, and we kind of shake them all up in a big airport. Do your best to keep a little space between people, even though these airports do get very crowded, and asking politely, could we just put a little more space between us, please? Masks are still absolutely required in airports, so make sure you have your mask on and maybe a spare if you're going to be in the airport for a long period of time. You'll see some people also opting for face shields for an extra level of protection. Make sure your hand sanitizer is with you and you're washing your hands often. And if you're able to, create a little bit of space on the aircraft between you and the next person, that's always a good idea. It's really the close contact of people. It's not necessarily just the anything about the air itself. It's the close contact that is really what allows COVID to jump from one person to the next. If you can go by train or bus, again, the less crowded, the better. A slight reduction in the risk, it's thought, when you opt for these, because there oftentimes is a little bit more opportunity to spread out. And then, of course, driving a personal vehicle is the greatest reduction in risk if the participants or the occupants of that vehicle are individuals in your household. And just remember that you're going to bring your travel exposures with you to your destination. So thinking about, this mask is uncomfortable, but I'm doing it because I'm going to go see grandma and I don't want to bring something to grandma. So making sure that you're doing it not only for you and your own health, but also for the people that you're about to gather with. So the last pitch, if you haven't been vaccinated yet, I wish that you can find the sources of information that you need to answer your personal questions about the vaccine. This vaccine, all of the vaccines now are so widely used, and there's so much data that has been amassed to look at how these vaccines are working and to look at any risks. And our systems have proven themselves to be able to find those risks, and to our agencies have proven themselves to halt a vaccine like they did with J&J until those risks were fully vetted. So I think it's time, if you are still on the fence about vaccination, to re-engage with a trusted health professional so that you can get your personal questions answered and hopefully be fully vaccinated to ring in the new year of 2022, which we all, I think, hope bring us, we hope to see this world take one more step towards life living with COVID in a much more even-keeled and calm kind of way. So with that, I wish you all a healthy and happy holiday season. We have about 20 minutes for questions. We'll take as many as we can. And if we don't have that many, that's fine too. But feel free to write into the chat, and I will stop sharing my screen, and we will answer some questions. So here, I'm going to look in the chat. And thank you to Will and to Tony for helping out with this. First question, how safe is it to attend an outdoor event like a football game at a stadium? Is this even possible? How can this be done safely? Oh, that's a great question. Particularly since, in my mind, football is so closely tied with Thanksgiving. So outdoors. So let's make sure we're talking about an outdoor stadium. I know some football stadiums, particularly in our most northern states, now have those roofs that keep them a little bit warmer during those cold winter months. So fully outdoor stadiums, can you be safe? Sure, you can. The first thing to do is get vaccinated and be fully vaccinated. The second thing to do is bring your mask with you. If you are uncomfortable because you feel like you're in close quarters with others, even though you're in the outdoor setting, you can always put your mask on, and that's going to continue to reduce your risk. We know that most transmissions do not occur in an outdoor setting. It's estimated that only about 10% of transmissions were occurring in an outdoor setting, and that estimate was from much earlier in the pandemic. So outdoors is always better than indoors. And then if you are feeling too close, because I know sometimes those little tiny spots on the bench that that your ticket gets you, you have someone right next to you, have a mask to put on. Also, you'll need a mask if you use the restrooms or go into any of the interior structures of the stadium. Can that be done safely? Absolutely. Now, if you are immune compromised or if you have other risks to self or to persons in your household, you have unvaccinated people in your household, you have young children, then it's really important to think through also what the transmission rate is in your community, because when you get to a large gathering, COVID will be there. COVID will be there. So thinking through how much of it will be there, like in an outdoor setting at a stadium, yes, you will likely have people in that stadium that have COVID, but how likely are you going to come into contact with that person depends on how many are there. You'll learn that from your local transmission rate. You'll also know whether or not you will come into direct contact with them and have that risk of transmission reduced if you're wearing your mask. So those are different ways you can think through how to attend an outdoor event safely. But if you're going to attend an outdoor event with a mask handy as a vaccinated person, you have done your due diligence to ensure you've done everything to reduce your risk. There is no such thing as zero risk right now. So I'm not saying you won't get COVID, but you have then done everything you can to reduce your risk. So maybe plan for that game and make sure in the 2 weeks after you don't have another trip planned or a big presentation at work or your child's holiday concert to attend, because if you do become ill, you'll be isolated during that time. What are your recommendations for a travel gathering with a newborn, 4 months old? Is it possible? Congratulations. Oh my gosh, a 4-month-old. I have an excellent pediatrician for my kids, and he gave me the best piece of advice before we traveled with a 6-week-old baby, was our first traveling. And he just looked at me and he said, "Don't let anybody touch a baby." I thought that is such an interesting concept, because he said, and I was a first-time parent, he said, people love babies, and they do. People love babies. I think we're all a little more aware that we shouldn't be going up and touching anybody. We definitely shouldn't be touching other people's children in this COVID timeframe. So I do think traveling with a 4-month-old is possible. I think if you can travel by personal vehicle, that's going to be safer than traveling in any type of communal vehicle like an airplane or a bus or a train. If you do decide, because you're not going to put a 4-month-old in a car and drive coast to coast, which is perfectly reasonable, making sure that you are fully vaccinated and that the people that you are traveling with are fully vaccinated, the people you're going to visit are fully vaccinated, helps to create that bubble around the child. And then also making sure that you are keeping that child close. At 4 months, they're not walking yet. So you put that baby, strap that baby to yourself, keep them nice and close, watch where they're putting their hands, because it goes straight into their mouth, and do the best you can. We have been very fortunate that children do get severe COVID, but it is not at the rate of adults and older adults. All of that being said, doing everything you can to protect that baby, particularly if that travel is really worth it to you. So this is that kind of decision-making process all families are going through. We do have guidance about the North Star for your family and how you identify that and make decisions from that based on how much COVID risk you want to intake. There is a Hopkins posting on that, and I will see if the team can post it underneath this session after it concludes. Good luck with that newborn, and I hope that you have safe travels. How do you navigate staying in a hotel and is staying in your own hotel room safe? So many hotels have developed cleaning procedures that are effective at keeping people safe from COVID in your own rooms. They wipe down the remotes and the light fixtures. They try and air out those rooms, all of those types of things. Some use light technology. So there you can call the hotel and say, what are your cleaning procedures for the room itself? But really the place where I think COVID is more likely to transmit from person to person would be in spaces like elevators, right? So if you can, take the elevators without others in them, or take the stairs. The hotel bar is another place where I think people congregate, and oftentimes that's people from all over the place, again, bringing all of their exposures with them. So avoiding those common spaces if you're not getting enough space. Sometimes when there's a continental breakfast in the morning, maybe you go and grab something and then you take it to your room, or you find a place outside to eat it. Those are different small steps that you can do to just reduce your risk when you're traveling. But hotels themselves, are they safe? Absolutely. If you put forth that additional effort to take the stairs instead of the elevator, to make sure you're not in crowded spaces in that hotel, they are definitely safe, and we see many hotels filling up quickly this holiday season. Any recs about how to talk to little kids about guidelines? So that's a great question. I think a lot of little kids know the guidelines better than most adults. A lot of kids who have been in a school setting have had to wear masks. Ways that I've talked to my kids about it is to talk about the why, right? Because we can get very fixated on how masks might not feel very comfortable at first, how they might tug or pull or hurt in some way, or just feel annoying. But I think the why is the important part, and helping kids think through that can be really important to them for understanding how they're a part of a community. And so if you're talking about masking guidelines with your kids, making sure that they're understanding this is what we're doing to help protect ourselves and to help others stay protected as well. Those types of very simplistic but very straightforward and clear and truthful reasons as to the why can be really helpful. What are your thoughts on indoor dining? What about outdoor events without a mask? So indoor dining is at this point in my community where I do see upticks in the community transmission rate, and I see a relatively good coverage rate. But again, I always look for that number when I'm looking at the percent vaccinated. I look for the number with the biggest denominator, because that biggest denominator is my full community. And we know kids can get infected with COVID and they can transmit it. And we saw 1 million kids get infected when schools went back in session in the first month. So I want to see what that total denominator is. So when I look at that for my state, it's right about 60%. And to me, that's too low. And that's why some of this vaccination transmission is starting to increase. And so how do I adjust my behaviors about that? Indoor dining, I still can't do. As a vaccinated mother of 3, my children will be getting their second dose immediately after Thanksgiving. I have not taken my children to indoor dining. I'm not even comfortable doing that. My husband's a clinician. He's also vaccinated and boosted. He and I we're not willing to do that right now as the transmissions are increasing. Outdoor dining, absolutely. I will put on my boots. I will put on my long underwear. I will put on a puffy coat, and I will enjoy outdoor dining. Outdoor events without a mask, absolutely. Particularly if I know the majority of the people at that outdoor event, and I know kind of what what their vaccination status is. If it's a place where I don't know people and it's pretty crowded as an outdoor event and I don't know their vaccination status, like at that stadium for that football game, I will definitely have my mask. How do very large indoor spaces affect transmission? Very large indoor spaces. Does it behave like an indoor transmission, or is it closer to outdoor transmission? So this is a great question. And you know what I oftentimes think of with this? I think about churches with this. And the reason why is there are a lot of churches that have big open spaces in them. And I think to myself, okay, there's a lot of space for the virus to kind of dissipate quickly if someone in here is infected. And so I do think to a certain extent, if it's a very large space, very high ceilings, for example, and if there's a little ventilation moving the air around a little bit, doors are open strategically or windows, something like that, then you are going to start to reduce that risk. Is it going to go down to exactly what it's like for outdoor transmission? No, because it isn't just the abundance and of air and ability to dissipate as in an outdoor setting. But can it get closer with bigger spaces and ventilation? Sure. If you are all packed into one area of that big space, then that big space isn't helping to benefit you, right? So spreading out in that big space is also what's really important. And I think it's also important to think about, like, what are you doing in that space, right? So as we saw early on with some of these outbreaks that were happening amongst choirs, going back to this church situation, and now we know that we can have singing in churches, but the choir needs to be spaced out and they need to be back a bit from individuals. But we know that people who are infectious do tend to spew more virus into the air when they sing or when you're talking or shouting very loudly. And so thinking about what's going on in those spaces and how can you start to open up those indoor spaces. Will they get closer to outdoor transmission rates? Probably they will move towards that very low risk of transmission in the outdoor space. But will they go away? No, it won't. It won't fully meet that outdoor space transmission rate, even in a large space. I've been invited to an event where everyone is vaccinated, but 2 had positive exposures after recent travel. Their quarantine has been completed. So is it safe? I am over 65 and not yet received a booster. So first of all, go get that booster. Absolutely get that booster in order to make sure that you are ready for what we're starting to see as the beginning of the winter surge. So that's the first thing. Second thing, if their quarantine has been completed and they were vaccinated breakthrough cases, is it safe to then be in the same space with them? Yes. Yes, it is. The science shows that, yes, it is safe to be back in those spaces with them. But really, to continue to protect yourself, get that booster. And if you still feel anxious or uncomfortable, here's the thing, you can always bring a mask and that mask will help protect you. So get that booster, enjoy those friends who unfortunately had breakthrough cases and are now off isolation. And hopefully you can re-engage with them. And if it makes you more comfortable to wear a mask while you do that, go for it. What's the difference in protection between 1 dose of the vaccine and 2 doses of the vaccine? Have someone in my family who has only gotten 1 dose? Okay, this is a great question. So if we're talking about the mRNA vaccine, which is Pfizer or Moderna, we need 2 doses of those vaccines to really stimulate our antibodies or our immune system to a fighting level where it can really fend off that virus and keep it from putting us into the hospital. And so if you only have 1 dose, it's better than nothing, but it is not considered fully vaccinated unless it was the J&J vaccine. So the J&J vaccine is a viral vector vaccine. You only need 1 dose and then you wait 2 weeks to give your body that time to mount that immune response, and then you're ready, you're fully vaccinated. So if you are engaging with an individual who has not reached full vaccination status, which is 2 doses of the mRNA vaccines, Pfizer and Moderna, plus 2 weeks, then that date, 2 weeks later, that's when you're fully vaccinated. Or it's 1 dose with J&J plus 2 weeks, that day after that 2 weeks is over, that's when you're fully vaccinated. That's when we say an individual has the immunity that is conferred by the vaccine that we know will protect them against hospitalization and death to the tune of about 90% vaccine effectiveness. So that's how that works. So if you're going to be engaging with this person who may not be fully vaccinated, it's best to consider them unvaccinated. So think through, what additional mitigation strategies you may want, whether you suggest they grab a quick antigen test before they gather. Those are important to help protecting everybody else who's at the event. Ooh, I got to keep going here. We got a lot of messages. TSA requires you to drop your mask for a few seconds at the airport. Does this defeat the purpose of wearing a mask and allow a greater risk of transmission at COVID? I'm glad you asked. I had that same question when I traveled for the first time in COVID over Labor Day weekend to go help a family member, and it was just me. And when they asked me to pull down my mask, I was in a hot panic for a second. They do it for the purposes of identification. They're trying to match you to your picture. So this is a cost benefit kind of balancing act that they're doing. They need to perform their duties for security. And they also, of course, want to help protect the population. Just remember that those individuals there that are checking, they're the people that are being exposed and breathing in all of that air that people are exhaling without their mask on. Does it defeat the purpose of wearing a mask? Absolutely not. Absolutely not. Masks worn consistently and correctly are spot on, but we see people don't wear masks consistently or correctly all the time. You can see them in your community all the time. And sometimes masks just slide down and we push them back up, but it's not just, we can't think about anyone's strategy as the minute you break that strategy, it's all out the window. That strategy isn't doing anything for you anymore. No, that's not true. Those strategies it's a game of probability. What we want to do is make sure that that mask is in place whenever that COVID virus comes our way. You may also note that most of the time TSA is asking you to do that while they're standing 6 feet from you, and they're asking other people to stand 6 feet from you. So they are trying to create a space around the person who pulled their mask down for a second and put it back up. But no, it does not negate the purposes of the mask wearing. How can you stay safe in a movie theater? Get vaccinated. Get vaccinated, bring a mask, and enjoy that movie. If you have too many people too close to you and the rate of transmission is too high in your community, then definitely bring a mask, but be vaccinated and enjoy your movie. Let's see. Okay, I think that's it. I think that's all the questions for today. I really enjoyed this conversation with you all. I wish you safe holiday travels. I wish you solid connections with family and friends, particularly if you are mourning the loss of someone either to COVID or sadly to our overdose epidemic that is also swirling right now. Your family is in my heart, and I hope that you all can get together and have that connection and celebrate that person's life, because there's a lot of healing to do in our country. So enjoy your holiday season. Be well, and we'll talk to you soon.